Stem cells are unique cells with the remarkable ability to self-renew, make more of themselves, and differentiate into various specialized cell types in the body. This makes them a cornerstone of regenerative medicine and holds immense promise for treating a wide range of conditions. Here are the key benefits of stem cells, based on established research and clinical applications as of 2026. 1. Regenerative medicine and tissue repair. Stem cells can be guided to become specific cell types, for example, heart muscle cells, nerve cells, or bone cells, to replace damaged or diseased tissues. This offers hope for repairing injuries or degenerative conditions where traditional treatments fall short. 2. Treatment of blood and immune disorders. The most established and life-saving use is hematopoietic stem cell transplantation, for example, bone marrow transplants. This has been successfully used for decades to treat leukemia and other blood cancers, lymphoma, aplastic anemia, certain immunodeficiencies and metabolic disorders. Healthy stem cells replace diseased or damaged bone marrow, often leading to cures or long-term remission. 3. Potential for neurodegenerative and neurological conditions. Stem cells are under intensive study for replacing lost or damaged neurons, offering potential benefits for Parkinson's disease, amyotrophic lateral sclerosis, ALS, spinal cord injuries, Alzheimer's disease in early research stages. They may help restore function by regenerating neural tissue or providing supportive factors. 4. Cardiovascular and heart disease repair. Stem cells can promote heart tissue repair after heart attacks or in heart failure by improving blood vessel formation, reducing scarring, and enhancing cardiac function. 5. Reducing inflammation and modulating the immune system. Many stem cell types, especially mesenchymal stem cells, release factors that suppress excessive inflammation, modulate immune responses, promote healing without strong immunosuppressive drugs. This benefits autoimmune conditions, chronic inflammation, and even conditions like graft versus host disease. 6. Orthopedic and joint conditions. Stem cell therapies show promise in osteoarthritis, tendon/ligament injuries, cartilage damage. They can reduce pain, decrease inflammation, and support tissue regeneration, often with minimal recovery time compared to surgery. 7. Advancing disease, understanding and drug testing. By watching stem cells mature into different tissues in the lab, researchers gain insights into how diseases develop, for example, birth defects, cancer. Stem cell-derived tissues also allow safer, more accurate drug testing before human trials. 8. Emerging areas under ongoing research as of 2026. Type 1 diabetes, replacing insulin-producing cells. Liver disease, wound healing and skin regeneration, potential anti-aging applications, e.g., tissue rejuvenation,